In today's health headlines, will COVID vaccines for the fall arrive in time to make a difference? How effective are routine blood tests for long COVID? And is any alcohol consumption good for your health? Joining me is Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine. Welcome.
Hi, thanks for having me.
You bet. COVID cases are surging this summer, and timing the vaccines right for the fall is looking to be a challenge. Will the boosters be available in time?
Yeah, so I mean, it's no doubt that COVID cases are on the rise. We're seeing more emergency department visits. We're seeing many people with more and more symptoms. What we're not fortunately seeing is a tremendous number of hospitalizations. I think that means that many of the prior infections people have had and a lot of the vaccinations people have had have provided some amount of protection. The new vaccine is not out yet. It is going to track a version of the Omicron variant, which is similar to the variants that are now out there. So while we don't know exactly how well they work, we know they will work fairly well. And I think they're still going to be particularly important for people to get because we know that you can get a COVID reinfection. And so even if you get a recent infection now, that doesn't mean that you can't get another COVID infection 4, 5, 6 months from now. And it'll be important to get vaccinated as soon as they're out in the next month or so.
All right, thanks so much. Researchers found that routine blood tests are not an effective way to diagnose long COVID. What can you tell us about this?
You know, researchers have been really trying to dig into long COVID now for the past year. And one of the things that's really challenging is there's no clear way to diagnose it. There's a constellation of symptoms that appear to really be what people are talking about when they say they have long COVID, but there's not a single blood test or a urine test or something you can point to. And so the researchers tested 25 different biomarkers or blood tests for long COVID, and none of them really seem to bear out. And so I think where that leaves us is this. Long COVID is real. It absolutely needs to be addressed. If you are having prolonged symptoms, you need to see your doctor, but be ready for the fact that it's going to be challenging to figure out whether you have it or not and how to treat it, as we're still really in the infancy of the research around it.
And finally, a new study found that moderate alcohol consumption does not have health benefits for older adults. So what do we know about that?
Yeah, this is now a larger study that was conducted and it really focused on older adults and drinking. And I think that it's consistent with a lot of the other recent research that has come out that is consistently showing that almost any amount of alcohol does have some negative health harms. Now, that's not to say that some people may be able to have some moderate amount of alcohol without health harms, but as people get older, as they have weaker immune systems, as they have heart disease, lung disease, other conditions, pretty consistently the research shows that any amount of alcohol causes harm, and that obviously binge drinking, chronic alcohol use disorder, more use is really associated with some major harms and healthcare costs. And so I think the takeaway for folks is this, is it's hard to stand up and say that that drink is costless for them.
All right. Thank you so much, Dr. Arjun Venkatesh. Have a great day.
Thank you.